guys. Either you're stumbling upon this video based on a recent diagnosis, or you could possibly be a physician or a clinician looking into some cases. I'm not really sure. So anyway, I wanted to give you a rundown of my case. Due to the fact that when I was diagnosed with posterior interosseous nerve syndrome and couldn't find hardly any testimonials on people's cases or outcomes, that was terrifying to me. I wanted to read up and learn about this situation as much as possible, and to have somebody to sound off of and hear their situation, and to make a more educated decision based on treatment plans. That wasn't given to me, so I'm hoping that maybe I can be someone's go-to person in the future due to this rare diagnosis. Additionally, what I did find was completely over-the-top medical jargon that only a medical doctor could probably decipher. So here is my situation. So about 2012, I noticed that there was slowing in my fingers. It really came to a head when I was in school. I was in a typing class, and while I've always been an exceptional typist, I had found myself not able to keep up with the demand of the class and had to drop out to figure out what was going on. I gave myself a couple years thinking, okay, it's probably related to an old softball injury I had when I was a kid. Essentially, my main symptoms of this condition were just these fingers drooped, these two here. And when I was in high school, I had a softball hit me right here in this finger, and it broke a bone back here. So to me, it made sense, didn't think much of it. So in about 2014, I decided that it was time to figure out what was going on, that this just wasn't getting better, it was getting worse essentially, and started my quest, and it was quite a quest. I started with just a normal physician who didn't know what was going on with me, who sent me to a hand surgeon. This hand surgeon didn't offer me much insight, thought it could be something neurological such as ALS, multiple sclerosis, none of which it turned out to be, but nonetheless, that was a terrifying thought at the time. Then I was sent to a neurologist who did some tests, a nerve conduction study specifically, where they put on little electrodes on your hand or on your arm, and they zap your nerves to get to tell whether or not they're communicating or freely moving. And that appeared normal, so was given another referral to a new hand surgeon who this time didn't really have anything to say different than I'd already heard. Didn't think I had ALS or anything, but thought, well, not sure, go see another doctor. So that time I was sent to another neurologist who this time did an EMG, which is where they stick needles into your muscle mass and they listen to your muscle to see if it's working correctly, or they know what sounds they're supposed to make. So that came back again normal. At that point, I was sent to an occupational therapist who was to help me work on the strength of my hand. Thinking maybe this is just some weird situation that you just need to build your muscle up because you stopped using your right hand when you're right-handed. Who knows? So I went there and didn't get any relief. I mean, I gained maybe a little bit of strength, but nothing that I should have. So the occupational therapist had actually thought that I had a nerve issue, but couldn't tell me one way or the other. She's not that specialist, and I had tests done proving that it wasn't. So at that point, I pretty much let it go. There was nothing to be done. I, exhausted my resources at that point without going to a whole new slew of doctors again. 2016, I had got a different insurance policy and was through the Kaiser network this time. So started off in January immediately in a doctor's office saying, let's try this again, see what I can find out. And that doctor was pretty disheartening. She pretty much told me, well, if there's nothing these specialists could tell you, then there's nothing that someone else is going to tell you. Like, well, let's still try. So at that point, I was sent to a orthopedic specialist who in turn said, I don't know what's going on with you. Because like I said, all I had were really these symptoms. These two fingers didn't want to move and still really don't, but they move better. So there was no pain that I really noticed. It wasn't anything out of the ordinary. So at that point, I was sent to a rheumatologist who told me that it wasn't rheumatological. However, that let's get an MRI of your wrist up to your fingers. Nothing turned up. Everything looked normal. She also sent me in for another nerve conduction study test and EMG. At that time, my EMG or nerve conduction, which one was it? My EMG showed evidence of denervation in the extensor digitorum muscle. So essentially, the internal muscle that controls these fingers wasn't functioning properly. Mind you, this is only really a year after the last test I had completed. So at that point, a second MRI was ordered, and this time it was ordered from my wrist to my elbow. And at that time is when I was told that the muscle inside here was atrophying substantially and needed to go back to the orthopedic doctor. And when I saw her, she at that point said, well, you have posterior interosseous nerve syndrome. You do not have a typical case of it, hence why this was so hard to diagnose. And in theory, I was actually lucky I got diagnosed. But nonetheless, she said, you need surgery. So in August, I went in and I had surgery to decompress my nerve. It has appeared to work. However, I've had expected complications. This area is very weird to touch. It's not that normal sensation you normally would get. I've had pain now that I never had before, but I think with any surgery that's bound to happen. But one thing that was explained to me after my procedure was that the muscle inside here was much more atrophied than they thought on the MRI. Therefore, the damage is probably permanent. It's not something that's going to just fix itself. It's possible, but unlikely. In addition, my orthopedic doctor, this was only her second case of this. It's not very common. So there wasn't much to go off of it. She could only give me, her background on the previous case, and she had seen two other cases prior to that one case. One was in her residency, and that case was a man who was begging essentially to get another surgery. I think she had said he was up to 4 surgeries, and it was just causing more damage than not. I obviously was told one surgery was the limit. If it didn't work, it didn't work. And then the other case that she didn't treat but had witnessed was an office worker in her building who had developed the condition and had a very promising outcome. It was caught early, it was treated early, and voila, she was essentially fixed. Her other case that she did treat, though, however, did have a recurrence of symptoms. Can't speak exactly to what this person's going through, but I can imagine it's pretty frustrating. For me, I pretty much have no idea how this happened. The ways it is, or what causes essentially is usually there's some kind of trauma to the area, or there's some kind of growth and they're compressing that nerve on that muscle. When she was inside my arm, she couldn't find anything that would lead her to believe there was a mass, or there was no mass, there was no injury, there's nothing that she can tell me for a certainty caused my condition. Therefore, every day I feel like it could be back to square one, not knowing exactly how my nerve got compressed. And I mean, essentially doesn't matter even if I go back to square one. It's my life has forever been changed, not in a sense of, tomorrow's my last, but more or less of everything I do, I have to consider, can I do it? A job, cooking, lifting things, if my finger gets stuck in a position, it's quite complicated to get it back out. It happens. So anyway, one thing I wanted to, kind of show you is when I was diagnosed, my doctor essentially gave me this packet, and it's called Uncommon Nerve Compression Syndromes of the Upper Extremity. This was all the information she could give me right here. So essentially these 3 columns to this point is what I was given to read up on. Was told that this is about all they could tell me. I shouldn't say all they could tell me. It was really all they could give you to give you some insight into it. And in this article it reads, 51% had a success rate after surgery. Now, what my doctor did say was that this test, or this study that was conducted, within those numbers, they can't honestly say for certainty that 51% was a success rate. Those numbers are flawed, that some of the patients that were treated for posterior interosseous nerve syndrome, or PINS, didn't really have PIN syndrome. They had something else but were treated as such, therefore perhaps had a good recovery. I'm not for sure, like I said, there's nothing out there other than these medical jargon reports that you just don't, there's so much to it. For example, here I got, what was it? It says, the extensor carpi ulnaris muscle and the supinator muscle, however, do appear to demonstrate potential mild to moderate atrophy with T1 hyperintense fatty infiltration. What does that even mean, right? So, even subjectively, these muscles may demonstrate a mild degree of elevated T2 signal, which could indicate denervation. There is no focal fluid collection or intramuscular soft tissue mass. This was essentially what my MRI read. So, I know what it read based on what my doctors told me. There was no mass in there. But without having a doctor to tell you what's going on, or even have someone to talk about it with, it's so overwhelming. And to not have any kind of true testimonials on people's situations, you just don't know what you're getting yourself into. Now, I will say my surgery, like I said, it was deemed so far successful. I was told at a year is where I'll be. If I still have this movement in a year, I should maintain that movement. But it's just trying to extend my fingers. My wrist wants to droop, and to compensate for the loss of that motion. I still am to this day doing therapy to try to get my muscle back, or to even get just some more movement back. I would love nothing more than to have a full recovery. But my surgery, like I said, was deemed successful. I didn't have any complications. They talk about a palsy where you can't, like I said, as you can tell, it's hard to just, come up and do that. Mine, I have to really work at it. And then as I do that, that's about, I can flatten this hand. That's about what I got. And I have to lift my wrist to get the full extension. That's where, I'm still really struggling. It's just, that lift motion, you can see I just don't have the movement I used to have. And probably will never. So, but what I had to go off on my surgery. I wanted to hear someone's, personal experience on my surgery, just to kind of give me peace of mind. Never had surgery before, so no idea. It was complicated. It was different. I was never in too much pain. I did take the pain pills the first few days. In the future, probably won't. I don't think I truly needed them. All they did to me was put me to sleep. I literally slept for 2-3 days, just tops. Got up to go to the bathroom, drink some water, eat a little bit of food, go back to bed. It wasn't as awful as I thought it would be. I really thought I would be in dire pain. I would have a bunch of complications. But the surgery was nothing compared to my daily life still. I'd probably go through a surgery again if it were to completely fix me, but that's impossible. So anyway, if you're, like I said, if you're listening to this and you're wanting to know more about my situation, please feel free to ask. Even if it's just support for yourself, I'm more than happy to give it. Apologize for how long it is. Can get a little rambling, but like I said, my from get to go, it took about 2+ years to get diagnosed. Therefore, there's a lot of stuff that I even left out because it wasn't necessarily relevant, but to me it was. Anyhow, if you need anything, any information, support, like I said, reach out to me. I hope that this gives someone some peace of mind in the future, or at least a little information that they can go off of instead of all those articles that just repeat the same or way over the head. So anyway, thanks for watching.